Hospitals by Professor Tammy.
Hospitals, Part 1. Introduction. The word inpatient. It means overnight stay when the patient is formally admitted with a physician's order. That means someone's staying in the hospital. They're inside the hospital, staying inside the hospital. Yeah, kind of say inside a lot, but you got the point. Outpatient. Services provided while the patient is not staying overnight in a health care institution. That means the patient can just leave that day, so they're in and out. They can go home. They do not stay in the hospital. So that's what outpatient means. Hospital, an institution with at least 6 beds and that delivers diagnostic and therapeutic services for medical conditions. A hospital must be licensed, have an organized physician staff, provide continuous nursing service under RN, which is registered nurses, have a governing body that is responsible for hospital conduct, have a CEO with responsibility for operations, maintain medical records on each patient, have pharmacy services available, provide food services to meet the nutritional and therapeutic requirements of the patients. Construction and operation of a hospital are governed by federal laws, state health department regulations, city ordinance, JCAHO, which is spelled JCAHO, fire codes, sanitation. Medical centers are a hospital that has achieved specialization and offers a wide scope of services, often engages in teaching and research. Exhibit 8.1 Major Stages of Hospital Evolution. 1. Almshouses as primary institution of social welfare. 2. Community-owned private hospitals as charitable institutions supported by affluent donors. 3. Institutions of medical practice and training serving the needs of all members of society and able to make a profit. 4. Emergence of relatively small number of physician-owned proprietary hospitals. 5. University-based centers of medical research. 6. Emergence of medical systems providing a large array of health services. Evolution of the hospital in the United States. So we'll be going through like a little history lesson here. Stage 1. That's before 1850. Only a few hospitals in some major U.S. cities. Almhouses or poorhouses or even pest houses, they provide social services rather than health care. Stage 2. Transition from primary government institutions to community institutions. They support mainly through private charitable donation. Stage 3. Medical discoveries transform hospitals into institutions of medical practice, a place for medical care and physician training. Discoveries include anesthesia, germ theory of disease, and x-rays. Stage 4. Advanced sanitation, nursing, and medical services. Well-to-do private pay patients started using hospitals because prior to that, they're like, oh, don't want to touch the hospitals. But now stage 4, they're like, ooh, let's start. No longer the hospitals are dependent on charitable contribution. The hospitals can generate profit now. Physician-owned hospitals lay the foundation of proprietary, like for-profit hospitals in the United States. Stage 5. Many hospitals established university affiliations. Research became an important adjunct to medical care. Hospitals became complex organizations. Hospital administration became a discipline in its own right. Trained department managers became necessary. Stage 6. Market pressures have prompted hospitals to merge or form affiliations. Medical systems have formed. Health systems may include more than one hospital. They provide a full array of health care services. Expansion and downsizing of the hospital in the United States. Number of hospital beds grew significantly between 1872 and 1929. Coincide with hospitals being centers of medical practice. Technology increased the volume of surgical work. Professional nursing enhanced patient care. Additional factors, if you look at Exhibit 8.2, factors contributing to the growth of hospitals on page 186. 1. Broad appeal. Once hospitals evolved into institutions of medical practice as a result of technological advances and professional training of healthcare professionals. 2. Private health insurance. 3. Hill-Burton Act. 4. Medicare and Medicaid. The Hill-Burton Act of 1946 have been credited with having the greatest impact on hospital expansion. The creation of Medicare and Medicaid in 1965 also fueled demand for hospital services. Hospital downsizing in the United States are triggered by PPS in the 1980s. Hospitals received a pre-established fixed rate per admission. PPS necessitated cost-cutting, quicker discharge of patients. Many hospitals across this country had to close. In the 1990s, managed care curtailed inpatient utilization. Managed care emphasized early discharge, outpatient services. PPS and managed care have the desired effect of reducing growth of hospital expenditures. Access and utilization measures. Measures of access, discharges. Total number of patients released from a hospital's acute care beds during a given period. So how many people were released from the hospital, whether you went home one way or another. Discharges per 1,000 population, an indicator of level of access to hospital inpatient services. Measures of utilization. Inpatient day, a night spent in the hospital by a patient. So you went in at 9 o'clock p.m. and stayed overnight at the hospital. That's considered one inpatient day. Average length of stay, ALOS, average number of days a patient spends in the hospital. Days of care, total number of inpatient days incurred by a population over a given period of time. Days of care equals discharges and average length of stay, ALOS. The elderly spend more time in hospitals than do younger people. Women are admitted to hospitals more often than men, but men incur longer stays. So women go to hospital more often, but men stay in the hospital longer. Hospital utilization is higher among blacks than whites. Utilization is higher among the poor than the non-poor. Overall, hospital utilization is higher among Medicare and Medicaid recipients. The average length of stay, ALOS, in the United States is 4.8 days. The sharp decline, ALOS, became possible when the growth of alternate services like home health, subacute long-term care. So, instead of staying in the hospital for that many amount of time, that length of time, there were alternatives. They can go home, someone will come and check up on them, or they might even have a home health aide, or they can go to a recovery center or rehabilitation center. No evidence that quicker discharge from hospitals harm patients. Utilization of hospital capacity. Capacity is the number of beds set up, staffed, and made available by hospital for inpatient use. 84% of community hospitals in the U.S. have fewer than 300 beds. The census is the number of patients on a given day. Patient days or days of care is equal to the cumulative census. Average daily census, patients days in a given period divided by days in that period. Occupancy rate, the percentage of capacity utilized during a defined period of time. It's derived by dividing the average daily census from the period by the capacity. Hospital employment. 19.6 million workers are employed in the healthcare and social assistance sector. 26% of the healthcare workers are employed in hospitals. Growth in the outpatient sector exceeds that in hospitals. Hospitals are expected to see the lowest job growth compared to other sectors of the healthcare industry.
See you soon. And remember to read the book.